SNUG 202 Assessment 3. Hi, my name is Chloe Smith, and this presentation is about a literature search on my clinical question. The question I chose is, ibuprofen more effective than paracetamol in the treatment of pediatric fever? The reason behind my choice is that someday I would like to become a pediatric nurse, so gaining the knowledge and having a greater understanding of the differences and or benefits between the two pharmaceuticals in relation to treating pediatric fever. This presentation will provide an overview of my search strategies, which include using the PICO framework and finding high levels of evidence, using databases to relate to my clinical question. It also summarises the findings of the article I found, which also includes parental and pediatrician influence on the two different pharmaceuticals and the limitations within the article. Evidence-based practice acts in accordance with a 5-step process. Step 1 being ask, which is asking a well-formed clinical question. For example, my question is ibuprofen more effective than paracetamol in the treatment of pediatric fever? Step 2 is using the PICO framework to list the key words from the clinical question to conduct the search. Step 3 is to appraise and synthesize the evidence to ensure it is reliable and is a high level of evidence. Step 4 is to integrate the evidence along with the clinical expertise and patient values. Step 5 is to assess the effectiveness of the intervention or decision. The PICO framework is a great tool when conducting research and using databases to find the best evidence-based practice. When conducting research and using databases, the PICO framework helps identify the key words in order to refine the search and find high levels of evidence. PICO stands for Population, Intervention, Comparison, and Outcome. I have structured my clinical question in the format of PICO, with my keywords being for P, fever pediatric, for I, ibuprofen, for C, paracetamol, and for O, reduced fever. I also put in alternative words, which is for P, children, infant, or newborn, for I, Advil, non-steroidal anti-inflammatory drug, also known as NSAIDs, for C, acetaminophen, Panadol, or Tylenol, and for O is afebrile. There are 7 levels of evidence. The levels of evidence helps find unbiased research. Here we have it structured into a pyramid, with the top being the best evidence and the bottom being the least effective evidence. Level 1 being a systematic review or meta-analysis of all relevant RCTs. Level 2 is evidence that is obtained from at least one well-designed RCT. Level 3 is the evidence that is obtained from well-designed controlled trials without randomization. Level 4 is a cohort study. Level 5 is a systematic review or descriptive qualitative study. Level 6 is a case-controlled studies or reports. Level 7 is background information or expert opinions. When researching to find the best evidence-based practice, it is important to use databases. Here I use SNUG and Medline. The reason I chose these databases is because SNUG includes top nursing and allied health literature, which is published by National League of Nursing and the American Nurses Association. Medline is the National Library of Medicine premier bibliographic database. This database contains more than 28 million references to journal articles in the life of science, with concentration in biomedicine. These two databases are reliable and are relevant to the evidence I am trying to gather in order to answer my clinical question. For example, I wouldn't use PsycInfo, as this database contains psychological literature which is not relevant to my clinical question. Here I am putting PICO keywords and alternative words into the database to help refine and broaden my search. I didn't need to use alternative words for the population, as my keywords was able to find high levels of evidence and also help refine my search. After searching using the PICO framework, I then changed the publication date to the last 10 years. I also changed the age range to all infant, preschool, and age 6 to 12, as this age range I am wanting to target. I am then left with 12 articles, which I then went through reviewing the titles and abstracts to find the highest level of evidence, and also ensure it was relevant to my clinical question. I was then left to one study in particular that matched my criteria. I chose this particular article as it is a systematic literature, which is the highest level of evidence. This article is also relevant to my question, as the aim of the study is to evaluate the evidence comparing the two pharmaceuticals to reduce fever in children. This study is focused on the age range 1 month to 12 years of age, which is within the pediatric age range. The publishers of this article studied 3,223 papers, which was then narrowed down to 8 in total based on the relevance to this study. This is just an overview of the findings I gathered from this systematic review. In this article, we find out, is ibuprofen more effective than paracetamol in the treatment of pediatric fever? The findings in this report convey that ibuprofen had a faster onset in all 5 studies that measured fever clearance time, with Panadol reducing fever at 71 minutes and ibuprofen reducing fever at 42 minutes. When looking at the peak plasma concentration, which is the highest concentration of the drug in the blood after the dose is given, paracetamol reaches peak level at 30 minutes, where ibuprofen reaches peak level at 60 minutes. In this systematic review, the findings were unexpected, as ibuprofen appeared to reduce fever in the first 4 hours quicker than paracetamol. Ibuprofen had reports of less discomfort at 24 hours at 69%, and the children given paracetamol at 44%. Ibuprofen has the potential to produce greater mean fall in temperature over extended time periods due to longer duration of action. This is just an overview of the findings I gathered from this systematic review. The results from 6 of the studies included in this review revealed that ibuprofen monotherapy was slightly but not significantly better at reducing fever in children than paracetamol monotherapy. Here you can see at 1 hour, the difference isn't that big, but ibuprofen does reduce fever better than paracetamol. And here at 4 hours, you can see it is only still a 1 point difference. And at 6 hours, also with the same 1 point difference in reduction of temperature. This is just an overview of the findings I gathered from this systematic review. Although the studies show that ibuprofen were more effective in reduction of temperature, parents and pediatricians choose paracetamol as their first choice antibiotic for reducing temperature in febrile children, at 97% reported using paracetamol over ibuprofen. This could be influenced due to paracetamol has been available over the counter longer than ibuprofen, this leading to familiarity of the product. This is just an overview of the findings I gathered from this systematic review. In this systematic review, there were limitations that included studies which incorporated a variety of age ranges, drug doses, temperature measurement routes, and for example, in this graph, it shows different definitions of febrile temperature in the different studies that were included in this systematic review. This is just an overview of the findings I gathered from this systematic review. Here I've chosen to do a Gibbs reflection on my process through this task. I was given this task to answer a clinical question by using the 5-step process of EPB. The question I chose is ibuprofen more effective than paracetamol in the treatment of pediatric fever? I formatted the question into a PICO structure using key and alternative words. Then I was able to use those words to refine my search in the databases SNUG and Medline, which I then come across a systematic review on the 2 pharmaceuticals and their effectiveness in the treatment of pediatric fever. Initially, I was a little worried, as searching databases was something entirely new and different. But as I dove into practicing and researching, I felt better about this assessment task and my ability to find higher levels of evidence using keywords, alternative words, and filters. While researching and using the databases SNUG and Medline, I initially was having troubles with refining my search, and I was ending up with 40 plus papers to look through. But with some practice, I was able to refine my search down to 12 papers which included higher levels of evidence to support my clinical question. I think the reason to my search was difficult at first was due to not being able to find the correct keywords and alternative words for my clinical question. But I was able to ask questions from my teachers, access support videos and Moodle to help make sense of why this wasn't going so well and how I could fix it. In conclusion, this task has broadened my knowledge on how to use databases and also find high levels of evidence to support any clinical question I may have in the future. The clinical question I chose was personal to me, as I would like to become a pediatric nurse, and also has changed my views on when/if I become a parent myself. I thought paracetamol was actually the best for reducing fever, but after reviewing and analysing this systematic review, I have changed my views on the 2 pharmaceuticals. When I do another search of a clinical question, I will continue to use the PICO framework, as it pinpoints the key words and alternative words that helps refine my search. Although something I would do differently is to research about the different databases there are and that is relevant to my clinical question, as this can improve my search and find more high levels of evidence that is relevant to my clinical question. In conclusion, is ibuprofen more effective than paracetamol in the treatment of pediatric fever? In this presentation, we discovered that ibuprofen does reduce fever slightly better than paracetamol and reported that ibuprofen had a greater effect at reducing fever after 24 hours. But there were some limitations to these findings, which included age range, dosage, and temperature route. We also find out that parents and pediatricians are more likely to choose Panadol for reducing fever due to it being a familiar product. My views have certainly changed about these two pharmaceuticals, I will be aware of this new knowledge and will be changing my future practice in relation to this systematic review. This final slide highlights the references utilised to develop this presentation.